Welcome back. Tonight we're talking about planning for families and choosing the right methods to prevent pregnancy when you aren't ready to start that family. Joining us now is Alice Akunyili. She represents the Black Physicians of Utah. Alice, welcome to the show. So glad to have you with us. Thanks for being here.
Thanks, Glenn.
A lot to consider when you want to start your family, especially when you aren't ready to do so. So what is involved and what should people consider when they're looking at proper family planning?
Well, there's really a lot to consider when you're thinking about family planning. You want to consider the size of the family, how spaced out you want your children to be. But for the most part, you really have to also consider your underlying health care status. And that's why you really want to have sort of physician support as you make those decisions.
Mm-hmm. And what are some of the various types of birth control that women should consider when they're looking into that?
Well, there are different ways. You really have to think of the sort of person that you are. So there's birth control, there's emergency contraception, but you also have sort of longer-term devices like intrauterine devices that could prevent pregnancy for longer periods of time. You could just leave them in, take them out every couple of years. And we do have variants that are with hormones, but we also have hormone-free versions as well. So depending on what's the best option for you, your physician will have that conversation.
And it's not just women who can look at birth control, men can as well. What options are available there?
Absolutely, and men obviously typically commonly would use a barrier method, so condoms, but a lot of men have been stepping up lately and getting vasectomies, which are completely reversible. So you could have a vasectomy, and then when you do decide to start your family, you could have that reversed and then have as many children as you'd like to.
Yeah, that's interesting to hear you say, because a lot of times when men take that step, they think it's permanent, but you've seen success in reversing that and being able to have families again.
Absolutely. You could reverse a vasectomy at any point, and if you want to be extra cautious, you could always bank some sperm in the eventuality that for some reason your vasectomy isn't as reversible. But for the most part, vasectomies are routinely reversed.
You talked about a lot of options for women. So as they're evaluating those, what should they consider in deciding which one is best for them?
Well, one of the factors that goes into this decision, unfortunately, has to be cost, because some of these options are more costly than others. They're not always covered by insurance. We have a lot of people who are underinsured, especially in the Black community, who might not have access to health care options, and so cost is definitely part of it. You want to consider your own underlying health status, but for the most part, birth control is very, very safe. And one thing I really want to add is the fact that emergency birth control is safe, and it also just prevents ovulation, and so it's not one of those things that prevents implantation. It's going to be always available in the state of Utah.
What methods tend to be the most safe or effective when it comes to birth control?
Well, I think one of the messages that I have for everyone listening today is that no method of birth control is foolproof. Even the ones that are 99.9% sure to prevent pregnancy, that's still 1 in 1,000 who might still end up getting pregnant. And that's why women do deserve the right to all the options in planning their health care.
Okay, we call that the oops, and that does happen every once in a while.
Exactly.
Right? Okay, let's talk religion and moral values. Because that can play a role when you're talking about birth control. What is your advice to patients when it comes to that?
Absolutely, and it should play a role, right? Everyone has to sort of find where they are in their own space and follow the options that best align with their own personal values, and that's absolutely acceptable. These are very private matters. These are very important matters for families to consider, and that's one of the reasons why women really should be at the center of making these decisions for themselves.
And you make it clear that that's something you want to discuss with your patients, or is that mostly left to them?
Well, I think that's one of the things that always gets discussed when you're talking to your primary care physician, when you're having discussions with your OB/GYN physician. So it will always get discussed in a physician-patient relationship situation. Absolutely.
That makes sense. You mentioned that cost can be a barrier or an obstacle. Are there options for free or low cost?
Absolutely, especially underinsured patients who might not have the resources. There is clinics by Intermountain. There's one up at North Temple. Utah Partners for Health has options, as well as Planned Parenthood in Utah.
Okay. Fascinating conversation. I wish we had more time to go into this a little more, but unfortunately we've run out of time. Really want to thank you for your time and being here with that advice, though.
It was a pleasure to be here. Thanks, Glenn.
All right.